Hi, my name is Maria Sidonche. I'm in my second year of getting my master's degree in public health sciences. I'm also a doctor, I'm a pediatrician, you can see it here. And today I want to talk about public health. But before I start, I want to show you a picture of my home screen photo. There it is. This is my niece. She's 7 months old and she's amazing. And this is her teething toy that I gave her as a present for Christmas. And just to be clear, it says here girl power. And oh boy, did it brought so much conversation during Christmas evening. Conversations like why do we still talk about feminism? It's 21st century, all women have the same equal rights, why talk about it, etc. And I understand this desire not to talk about such difficult topics and difficult things. But not talking about feminism is a privileged position. It is easy not to talk about women's rights when you see that all girls in your community go to school, they get the chance to get higher education, apply to universities, get married at the age that they seem appropriate to someone who they seem appropriate to. They won't be married at 13 and they won't get brutally mutilated by female circumcision. It is easy not to think about inequalities and thinking that this happens somewhere far away and this doesn't concern us. So, why should we be bothered? Why should we talk about feminism at all? And why should we talk about medical feminism in particular? And what does it have to do with public health? Well, I'm getting my degree in public health, a degree that is focused on health of human populations and individuals. So let's talk about women's rights and women's health. When I applied to medical school and got my degree, I never questioned that I could become a doctor. I never questioned the right to apply to medical school in the first place. But just 150 years ago, 7 women were the first ones to enroll to medical school to get a medical degree. There were 7 of them because when the first woman applied there in 1869, Sophia Jacksblade was her name. She was told that it is inconvenient for the university to get all the professors to teach her separately from her classmates, who were male at that point. Thus, she was denied the right to even apply. So she went ahead and published a news article wondering if there were any other women interested in getting a medical degree. This is how the Edinburgh 7 was born. They faced so many obstacles on their way: abuse, obstruction, and even violent riot outside the university walls. The goal of the riot was to prevent those women from entering an anatomy exam. I remember how nervous I was during my anatomy exam. Can you imagine a riot outside the walls trying to prevent you from taking the exam in the first place? These women were known as the Edinburgh 7. They achieved everything that was expected from them, but they were never allowed to graduate. They were told to stop. They would later go on, and 5 of them would get to graduate abroad and get their medical degree. They would become key figures in establishing medical schools for women in Europe. They weren't asking for anything special. They were asking for the same. And this is what feminism is about. And this is what we'll talk in this video. This is a uterus. It is an organ from which all of us are born. Another name for it is hyster. And it was believed that uterus was the one to be blamed for excessive emotion in women. Thus, a word hysteria. This term was used to describe and dismiss most of female illnesses. According to Hippocrates, the best remedy to treat this condition is rigorous sex. Aristotle also held that belief. He also said that woman is a mutilated, deformed form of male body with a bad biology. This was 1,000 years ago, but it still has an impact on modern medicine nowadays. The male body is considered as a default to study everything. Much of the research is done proportionally more on male animal models, male mice, and male participants. And up until 1993, women were excluded from drug and clinical trials. This was due to their hormone fluctuation during monthly periods. And therefore, we still have so much knowledge gaps about drug effects, about women health, and I have a few examples of this. This is a muscle system. It was also my cup of tea, but that's a muscle system. That's the one that we used to see in everywhere. And this is a male muscle system because a woman's muscle system should include mammary glands, breasts, and it should look like this. This is a drug called ADI. It is a prescription drug that is targeted to increase female libido. When it is prescribed, women are told not to consume alcohol with it because alcohol was shown to increase negative side effects. And how do we know it? From studies. And most of the studies were performed on men. Let me show you another example of medication that made it to markets but didn't include enough women in research phase. A drug called Ambient. It is a sleeping pill. And what is interesting is that this drug is metabolized by men much faster than by women. And because we didn't know it at the time, this caused serious problems starting from involuntary sleep eating to involuntary sleep driving. And the stories are scary. And only in 2013 did the FDA told women to have the doses they were taking of this drug. And the third example that I have from medical feminism is about heart attack. When having a heart attack, men and women present with similar symptoms, chest pain. But sometimes women can present with associated symptoms, for example, palpitation, nausea. And this can affect clinician judgment on whether or not she's even having a heart attack. Even if we suspect the diagnosis, the test that we use to confirm it, it's a blood test that shows a certain enzyme in it, and this enzyme gets there when the heart muscle is damaged. And up until recently, the cutoff, the threshold for this enzyme was too high for women, and this caused doctors to dismiss a heart attack in women when it was actually happening. That actually makes sense because women's heart is smaller, and so relatively, the enzyme they would release relatively less enzyme in the bloodstream. And these biases, they still exist in medicine, and we have so much work ahead of correcting and identifying them. And that is why I'm studying public health sciences. That's the science that will help us identify the causation between these differences. It is so important for me to know medicine. I can make so much difference with medicine. By identifying and knowing public health, I can make a difference on a larger scale. And that is why I'm so happy to learn public health sciences. And that's how I think I'll make a difference. With my background as a doctor, with my future in public health, and as a feminist myself. Thank you.